Hello everyone, my name is Samantha Davis, RN, BSN RN, and today I'm presenting my PowerPoint presentation for Jacksonville State University's MSN Population Health Program. My topic of conversation for this presentation, with everything going on in the world and the state of our union, state of our nation, is COVID-19. The presentation is titled COVID-19 Safety Guidelines and Practices. First, I'd like to start with my practicum objectives. Starting, we're to develop an oral presentation with PowerPoint utilizing Gagne's 9 events of instruction, including student learning outcomes and methods of assessment and evaluation. Incorporate icebreaker activities, case studies, current events to swiftly attain students' attention and interest. And then to identify barriers and challenges during the practicum learning experience. Utilize a learning management system to allow students to access needed materials outside of course meeting times. Recognize legal, ethical, and professional responsibilities as a nurse educator. Utilize a variety of assessment methods and evaluation of student learning. Employ teaching principles, educational theories, and evidence-based practice learned within nursing program in the classroom setting as a nurse educator. And last but not least, use self-reflection as a strategy for professional growth and development as a nurse educator. After presentation, students or learners will be able to demonstrate appropriate application of PPE, which is personal protective equipment, understand proper guidelines and practices to decrease contracting COVID-19, demonstrate appropriate application of masks, face coverings, and understand what causes COVID-19 and symptoms that may appear. The death toll and infection for COVID-19 in the United States, as reported by CDC, which is the Center for Disease Control and Prevention, they're reporting that 29 million cases of people that are infected is what they're saying. 29 million cases of infection. Plus, they check daily and kind of the numbers kind of change, but 29 million cases plus another 40,336, and those are the cases of infection. And then 525,000 deaths. That means individuals that have succumbed to the virus. And then once again, the numbers kind of change daily because you have people dying and new infections, and add another 682 to that number. Death toll and infection for COVID-19 in the United States, as reported by the CDC, Center for Disease Control and Prevention. As of January 1st of this year, 2021, the United States surpasses 20 million as deaths have continued to mount. Here I have put together an outline for COVID-19 safety guidelines and practices. And throughout the PowerPoint, these topics will be covered. What is COVID-19? What causes COVID-19 and how does it spread? Symptoms that may occur if infected. Proper guidelines and practices to prevent contracting COVID. Appropriate application of masks, face coverings, proper hand washing, and sanitizer use. And then the appropriate application of PPE, personal protective equipment. Now, let's discuss COVID-19. What is COVID-19 exactly? COVID-19, also known as coronavirus disease, is an infectious disease caused by a newly discovered coronavirus. I believe we kind of saw what COVID-19 was and how bad it can be. Maybe the first part of January 2020. Once again, we're still on that topic. What is COVID-19? COVID-19 is caused by a coronavirus, also called SARS-CoV-2, older adults, and people who have severe underlying medical conditions like heart or lung disease or diabetes, and also people that are immunocompromised, such as ones that have had maybe a transplant, some type of transplant, and they have to be on rejection medicines to keep the body from rejecting the organ, or someone that is HIV positive or battling the AIDS disease. These individuals are at high risk for developing more serious complications from COVID-19 illness, and this is also reported via the CDC. How does COVID spread? COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other within about 6 feet. People who are infected but do not show symptoms can also spread the virus. Cases of reinfection with COVID-19 have been reported, but are said by CDC to be rare. We are still learning about how the virus spreads and the severity of the illness that it causes. Symptoms that may occur if infected. Symptoms that may occur if infected can vary but due to age, the physical state of the person, chronic illnesses. All of these things kind of play a part in symptoms and how the person will body will respond to the symptoms if in fact they are affected or infected with the COVID-19 virus. And some people's symptoms are severe and others are mild and they can be managed at home, and others cannot. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe symptoms. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, loss of appetite, also loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. If any of these symptoms are present, it is highly recommended to seek professional help. Medical professional help. Proper guidelines and practices to prevent contraction. 3 factors to help you make safer choices: location, proximity, and time. These 3 things are said to really help decrease the chances of contraction. Location. Open air spaces are much safer, or said to be much safer than enclosed spaces. Proximity. Farther away from other individuals is much safer than being close together. And it's said to be at least 6 feet. And time. Shorter time periods with others are safer. If you're visiting family in a long-term care facility, some facilities have strict no visitation policies. But if you're, like the hospital, nursing home, or long-term care facility, if in fact they do allow you to visit, maybe once a week or something like that, then following certain guidelines are pertinent. If you feel unwell, go ahead and cancel your visit. Check in advance. Call ahead to say I'm on my way. Just check in advance and let them know you're coming. Stay safe during the visit. Wear a mask and keep your distance, which I think these are already part of the policy and are mandatory. Continue to stay in touch via phone and video calls. I think this is also pertinent, being that the family member is indeed kind of cooped up in the hospital or some type of facility, and they really need to know that you're concerned and that you care and that you love them, and you don't want them to feel like things can start to mentally weigh on someone that is quarantined and in a facility, and sometimes the stay is longer than, depending on how the virus or the infection, or if they have chronic illnesses. When you're out shopping for groceries, you need to follow certain guidelines. Go during hours that are not peak hours, when there's not, early in the morning or late at night, when, just go during peak hours. That'll also help. Before you get there, have your mask, have your own hand sanitizer, just in case the facility or the grocery store does not have masks to pass out or does not have hand sanitizer when you walk in the door. Keep your shopping time short and make a list. Go ahead and make a list before you get there and keep it short. And once you're inside the grocery store, stay within 6 feet of each other. Be courteous and stay within 6 feet of the next shopper. And if you have another important thing, if you have medical appointments, don't put off necessary medical appointments because of COVID. Just do things to try to reduce your risk. Call ahead. Already have your appointments and stuff scheduled, or, don't try to go in as a walk-in. Before you get there, I'll have your hand sanitizer and your mask already with you. And then once you get there and you see other patients or other people, just keep your distance. Try to stay as far away from each other, preferably 6 feet and greater as you can. And the next thing is how to prepare in case someone in the home is sick. If someone in the home is sick, then the biggest thing is that you want the person to be isolated. Have their own room, be isolated from everyone else. And be in a room where there is well ventilated. Have the windows open. Reduce contact with the person that is infected. Don't be sitting in the room and this and that. Just try to reduce contact with them. And have one household member to maybe be the go-to person to do everything and kind of check on the person, this and that, and take food there and just whatever. But that person needs to be someone that is not of high risk and doesn't have a lot of chronic illnesses if possible. Wear a mask even though you are in the home. Use separate dishes, cups, utensils, and bedding. And clean. Clean and disinfect frequently, preferably with Lysol and bleach or some type of agent that kills at least 90 to 99% of the virus. Proper guidelines and practices to prevent contraction continued. Maintain at least 1 meter distance between yourself and others to reduce your risk of infection. When they cough, sneeze, or speak, maintain an even greater distance between yourself and others when indoors. The further away, the better. Make wearing a mask a normal part of being around other people. The appropriate use, storage, and cleaning of disposable disposable masks and stuff are essential to making those masks effective. And then we'll go over the appropriate application of masks and face coverings, proper hand washing, and sanitizer use. How to wear a mask. Clean your hands before you do anything. Wash your hands before you do anything. Before you put the mask on, as well as before and after you take it off. Make sure it covers both your nose, mouth, and chin. It does not just need to cover your mouth and chin and have your nose out in the open. It needs to cover the nose, the mouth, and the chin. When you take off a mask, store it in a clean plastic bag. And every day, either wash it if it's fabric or dispose of it if it's a medical mask and get a new one. Do not use masks with valves. Hand washing, hand sanitizer use. There's germs everywhere. They can get into hands, items we touch during daily activities, and make us sick. The biggest thing is good. You can use hand sanitizer, but the biggest thing is soap and water. You need to wash your hands. Hand washing reduces the amount of all types of germs, pesticides, and metals on hands. Knowing when to clean your hands and which method to use will give you the best chance of preventing sickness and illness. Appropriate applications of PPE. Well, this all listed here. How to put on a mask. We've kind of went over that. Mask, face covering, shields, shoe covers, disposable gowns that cover the clothing. All of these things are pertinent and help cut down on infection. And a plan for future improvement. We must do better with mask wear. And sometimes when I'm out and about, I guess some people feel that it just does not apply to them. They don't wear a mask and they really fuss, carry on about their rights as humans that they don't have to wear a mask. We must do better with mask wearing, hand washing, social distancing, and self-care. To continue, the numbers have started to decline. To continue with the declination in the COVID-19 infections and death. This is my conclusion. My conclusion: before the coronavirus disease 2019 pandemic, about 6 in 10 adults in the United States had a chronic condition. 90% of the nation's healthcare expenditures were for people with chronic and mental health conditions, and chronic conditions accounted for 7 of the 10 leading causes of death in the United States. The COVID-19 pandemic has only further emphasized the importance of chronic disease prevention and care, especially because many chronic conditions increase the severity of COVID-19's outcomes. Self-care is a must. This is my references. Thank you.